Hello and welcome to this special show on Swasth Immunized India. Vaccines save millions of lives globally each year. India, we have the biggest immunization program in the world. But despite that, we have not been able to achieve the target of 100% immunization coverage. We have with us today to discuss what are the gaps that we need to fill and how we can do that. So we have Dr. Dinesh Agarwal from the Indian Academy of Pediatrics. We have Dr. Rajiv Ranjan, a senior pediatrician, and we have Mr. Arvind Singh, who works with the non-profit Matri Sudha, and he's the head of research and advocacy. So to start with you, Dr. Ranjan, what are the problems that parents come to you with when it comes to immunization? Do they have a lot of questions, or what is stopping them from immunizing their children?
Nowadays, when we consider about the immunization, it has grown in the, like we are in city like Noida. We don't face that much problem because people are a lot more educated. They're from the MNC companies, but still they have got a lot of doubts, a lot of concerns about their kids that after vaccination they might have some side effects, and especially when we talk about the MMR vaccination, a lot of parents, like educated parents, they feel that MMR vaccination causes autism, because there is a substance called thimerosal, So there was no medical documentation about those, but still people feel that MMR will cause autism. So that is a great challenge when we talk about the MMR. Rest of vaccination, pain, swelling and fever, because all are working, so they want to get it done vaccinated on the weekends, so that they can have time with their kids, So in the first 3 vaccination, like 6 weeks, 10 weeks, 14 weeks, we face high grade temperature, pain, swelling, localized swelling. So they are concerned about those symptoms, Rest in city like Noida, we don't face much problems in educated class.
Dr. Dinesh, when we talk of these kind of myths that people have, that children will develop autism or there are other diseases which children will get, how justified or valid these, arguments are?
This is a myth about MMR, it causes the autism. But most of the studies have done, it has no correlation between MMR and autism. Only there was one study which shows their relationship between MMR and autism. That is why this paper has published nuisance in the vaccination program, failure of this vaccination program, because a lot of people read that paper, that causes in the mind of the people, it causes the MMR. Otherwise, there is no correlation between MMR and vaccine. And because the public is aware of doctors, public both are aware of autism, and this is the age when the autism normally diagnosed, because pediatrician also now aware of the autism. Earlier we were not used to be aware of these things. And secondly, mild illness is also included in this category. So there is a coincidence, you can say, people autism and MMR, there is no correlation between the MMR and.
You just said that this has really created a dent in the program, which was otherwise pretty solid. But how do you cater to this, to an urban section, a middle class, section of people, families who are pretty well educated and they have access to a lot of information available on the websites? So how do you try to, make them understand that these are not very just?
Basically, this is the overlapping of the time we do the MMR vaccination, what Dr. Dinesh told. It is 9 months and 15 months. Now the first dose we get at 9 months, second at 15 months. So this time we used to diagnose the autism, but there is no medical documentation about that. We aware the parents, we counsel them that there is no relation, We give the examples of so many thousands vaccination we have done in our career, and there is not a single incidence where we have found that a child has got autism after getting any sort of vaccination, not MMR.
So you want to add something? Okay. These are the people who are actually coming to the clinics and they are being informed by the doctors. But coming to you, Mr. Singh, you work with with a section of the society which may not necessarily approach healthcare centers for vaccination. So what kind of problems do you face, like reaching the people who are they very hesitant when it comes to vaccinating their children? And do they have similar concerns of autism?
कंसर्न्स तो रहते हैं इनफैक्ट, लेकिन जिस तरह से पूरा वैक्सीनेशन का प्रोग्राम को गवर्नमेंट की तरफ से पुश मिला है पिछले लास्ट 1.5 डिकेड्स में खासकर, और जिस तरह की कम्युनिटी में हम लोग काम करते हैं, जिस तरह की कम्युनिटी में हम रिप्रेजेंट करते हैं खासकर, मिथ्स और ट्रेडिशनल प्रैक्टिसेस रही हैं कि टीकाकरण करवाना है या नहीं करवाना है, साथ वाला टीकाकरण करवा रहा है इसलिए मैं भी अपने बच्चे का टीकाकरण करा लूँ, इस तरह की प्रेवलेंट प्रैक्टिसेस रही हैं। और मिथ्स को लेकर सिर्फ कोई जिस तरह की कम्युनिटी से में हम लोग काम करते हैं वहाँ पर कुछ रिसर्च साइंटिफिक एविडेंसेस को की एक्सेसिबिलिटी।
I'll just break you here. If you can just explain a bit about the communities you work with, so we'll have a better idea of this.
हम लोग जो खासकर काम करते हैं दिल्ली के अर्बन स्लम्स हम लोग काम करते हैं, और जो खासकर जो इंटरवेंशन एरियाज़ हैं हम लोग बच्चों के साथ, महिलाओं के साथ खासकर काम हम लोग करते हैं। एक लाइफ साइकिल अप्रोच है हमारी काम करने की, जिसमें हम लोग प्रेगनेंसी से लेकर फर्स्ट 2 years ऑफ लाइफ तक काम करते हैं, जिसमें वैक्सीनेशन भी एक इम्पॉर्टेंट कंपोनेंट है। मेजर जो हमारा जो काम करने का जो फोकस एरिया रहता है वो ये था कि प्रिवेंशन पे कैसे खासकर काम करेंगे, और क्योंकि टीकाकरण जो है वो एक लाइफ साइकिल अप्रोच में एक कंपोनेंट है, इसीलिए हम लोग दूसरे एस्पेक्ट्स को भी देखते हैं, जिसमें हम लोग न्यूट्रिशन की बात करते हैं, हम लोग प्रेगनेंसी के टाइम पर एंटीनेटल चेकअप्स की बात करते हैं, और सिर्फ बच्चे को टीकाकरण तो बाद में आता है, शुरुआत तो माँ से होती है, जब वो प्रेग्नेंट है उस दौरान बात होती है, और वहीं से एक्चुअली एक एनेबलिंग एनवायरनमेंट हम लोग क्रिएट करते हैं फैमिली में कि टीकाकरण को लेकर कैसे हम लोग फैमिलीज़ को बात करें, फैमिलीज़ को कैसे हम लोग अवेयर करें, और ये जो मिथ्स और जो टैबूज़ हैं, खासकर काम ये है कि मिथ्स और टैबूज़ को कैसे ब्रेक किया जाए। जैसे उदाहरण के तौर पे आपको बताऊं, हम लोगों ने जब शुरुआत किया था तो पल्स पोलियो वैक्सीनेशन को भी कराना एक मुश्किल काम होता था, तो अवेयरनेस एक साइड पे काम एक लेयर है जहाँ हम लोग काम करते हैं। दूसरा लेयर है कि जहाँ पर गवर्नमेंट के जो सिस्टम है उसको कैसे एक्टिवेट किया जाए, गवर्नमेंट की सर्विसेज कैसे लोगों तक पहुँचें, ये काम भी पूरे कंपोनेंट का एक एक्टिव पार्ट है। और जिस स्लम्स में हम लोग खासकर काम करते हैं, तो के बाद लाल कुआं साउथ ईस्ट दिल्ली के एक मेजर कंपोनेंट्स एरियाज़ में आता है। और जब हमने शुरुआत की थी तो पल्स पोलियो की एक बड़ा ड्रॉबैक था कि वहाँ पर एक्सेसिबिलिटी नहीं थी, वहाँ पर अवेयरनेस नहीं था। पल्स पोलियो के लिए भी मिथ्स और मिसकंसेप्शंस थे, फ्रॉम रिलीजियस पॉइंट ऑफ व्यू, फ्रॉम ट्रेडिशनल पॉइंट ऑफ व्यू, उनकी ओल्ड प्रैक्टिसेस थी कि बच्चों को आप टीकाकरण की साइकिल में कभी इन्वॉल्व ना करें। दूसरा ये था कि लोगों के पास वो सर्विसेज अवेल करने की अपॉर्चुनिटी नहीं थी। जैसे जिस एरिया से हम लोग आते हैं लाल कुआं से, वहाँ पर कभी भी हेल्थ सेंटर्स नहीं हुआ करता था 2013 से पहले, तो एक लंबा टाइम जो है वो चला गया विदाउट एनी हेल्थ केयर इंस्टीट्यूशन। तो कोशिश ये थी कि हम लोग अवेयरनेस के साथ साथ में मिथ्स और टैबूज को ब्रेक करें, और उस टैबूज को ब्रेक करने के साथ साथ में हम लोग कैसे फैमिलीज को उस एक्सेसिबिलिटी तक लेके जाएं, उस इंस्टीट्यूशन तक लेके जाएं, ताकि सर्विसेज जो सरकार दे रही है, जो गवर्नमेंट की तरफ से आ रहे हैं, वो लोगों तक पहुंचे।
You raised a few important points in your answers. One of the things is that vaccine is not alone going to prevent the child from any disease. So, sir, coming to you and to you, Dr. Ranjan, what other factors are really important when it comes to the health of the children?
When we talk about the immunization, it is a process where we immune the body or give the resistance to the body to the different infectious diseases. So it is a process where body also plays an important. So immunity level of the child, nutrition level is very important. So what is the socio-economic status of the child is very important.
And I believe families from the lower strata of socio-economic status are the least covered by immunization, if I'm not wrong.
Because they are not aware of. That is the reason. One is the aware.
By Mr. Arvind, these are the accessibility, awareness, and these geographical regions are also involved.
So when we talk of accessibility, presence of a healthcare center or a healthcare worker near the villages is extremely crucial. How do you see, do you see this as a hindrance in areas which are unreached?
If the accessibility is there, awareness is there, they go to door, then their coverage will increase. That is the one. Secondly, the media advertisement of this now in the news program, government and publish in the media, that have increased the and door-to-door assessment like pulse polio program. Initially they started in the center, and then they started going to the house to house. The coverage then increases.
Coming to polio, it's like it was a huge campaign, and the kind of push we saw that the government gave to this campaign, I mean, eradication of polio in 2014 is a result of that. But we can't possibly invest or have such campaigns for each and every preventable disease that we have. So what is the way forward? I mean, polio is a great example, but do we have that kind of resources or that kind of infrastructure on the ground to push the vaccines?
I think cost effectiveness is another issue.
Right.
So polio was well funded and I think grossly accepted across India. I think
also, if I can just cut you here, it was oral drops, and then a lot of vaccines are injectable.
Mode of vaccination is also important. Whenever parents come to us and they ask us, Doctor, this is oral, because now rotavirus and this is the two vaccines available, oral route. So they are more convenient. Again, they are apprehensive about the pain, swelling, fever, side effects, And parents used to relate all their problems with the vaccination. All their problems. If the vaccine,
you can give us an example, sir.
like if on Monday they have got the vaccination, if baby has got cough on Wednesday, they will ask the doctor, after the vaccination, baby has developed the cough,
So these are completely unrelated issues.
Only local issue like pain and swelling, fever, that could be the side effects of any vaccine, that's all.
Arvind, coming to you, working in areas where the awareness is pretty low when it comes to vaccination, do people make the same linkages?
They do, in fact, swelling, fever. These are some of the very common things we come across, and तो इसी टैबूज़ को और ये जो इस तरह मिसकंसेप्शंस जो ब्रेक होते हैं, हम लोग का एक इम्पॉर्टेंट कंपोनेंट ये होता है कि हम लोग जो वैक्सीनेशन डे है, जैसे हम लोग विलेज हेल्थ एंड न्यूट्रिशन डेज बोलते हैं, इन दिल्ली के कॉन्टेक्स्ट में विलेज हेल्थ न्यूट्रिशन डेज इज़ मोर ऑफ अ वैक्सीनेशन डे. तो हम लोग खासकर जो हमारा जो प्रोजेक्ट इंटरवेंशन एरिया है, जहाँ पर हम लोग एक ऑर्गेनाइजेशन है चाइल्ड राइट्स एंड यूथ क्राई के साथ हम लोग काम करते हैं, हम लोग ये इंश्योर करते हैं कि वैक्सीनेशन वाले दिन हम लोग आशा वर्कर्स ANM के साथ हम लोग साथ में रहें, वो डोज को डिलीवर करें, और हम साथ साथ में अवेयरनेस और जो इस तरह की जो बातचीत होती है, हम लोग हमारा एक पूरा प्रिसाइज डॉक्यूमेंट होता है, मॉड्यूल होता है जिसमें हम लोग उनको बताते हैं वैक्सीनेशन के बारे में, मिसकंसेप्शंस ब्रेक किए जाते हैं. और इसी का फ़ायदा है कि पिछले 15 सालों में जो इंटरवेंशन खासकर हुए हैं, वैक्सीनेशन का कवरेज भी उस एरिया में बढ़ गया. ऑलमोस्ट पिछली बार भी जब डिस्कशन हुआ तो 98-99% का कवरेज हो गया है, और कवरेज के साथ साथ में जो पूरा आउटकम आना है ऑलमोस्ट कि बच्चा उतने महीने पर डोज ले रहा है या नहीं ले रहा है, ये सारी चीज़ें हम लोग हाउस होल्ड टू हाउस होल्ड लेवल मॉनिटर करते हैं, और उसका फिर एक हम लोग डेटाबेस बनाते हैं कि कौन सा बच्चा छूट गया है और किस माँ के पास MCPC कार्ड नहीं है. ये सारी बातें फिर हम लोग ले आके हेल्थ इंस्टीट्यूशन से बात करते हैं, और जो उनके एग्जिस्टिंग चैलेंजेस होते हैं उनको समझने के बाद एंड देन वी कम बैक टू द कम्युनिटी कि हम लोग एटलीस्ट ये श्योर करें कि जो पूरा कवरेज है वो हर एक बच्चे तक पहुंच रहा है, नहीं पहुंच रहा है.
Sir, at IAP, you must be interacting with a lot of other doctors. So, apart from big cities, in smaller cities, are the issues any different, or do people come up with different concerns about vaccination?
I think that the problem is the same everywhere, but in big cities, because the awareness, media campaign, and government willingness, these are the things which can improving the vaccination coverage. In smaller city, I think a social organization can improve this. That is why government have started in Dhanush program, and so the lot of media coverage is there. So people are aware, and then the coverage of the vaccination is increased after that program.
Right. You talked about Ashas and Anganwadi workers. They form a very big part of our healthcare delivery mechanism, especially at the ground level. Do you also work with them a lot, and what challenges do they face when they're going door to door and convincing women especially about vaccination?
आशा वर्कर्स और आंगनवाड़ी वर्कर्स का इनफैक्ट बहुत इंपॉर्टेंट रोल है. ICDS प्रोग्राम जब 75 में शुरू हुआ था तो ऑलमोस्ट देर आर 13 लाख आंगनवाड़ी सेंटर्स अक्रॉस द कंट्री. एक बड़ा नेटवर्क है खासकर, और जिस बेनिफिशरी के लिए वो काम करते हैं वो बच्चा है 6 साल से नीचे वाला, और वो एक वुमेन है जो प्रेगनेंसी से लेकर पोस्ट प्रेगनेंसी तक उनके साथ काम होता है. आशा वर्कर क्योंकि NRHM 2005 में आया, एक बड़ा नेटवर्क गवर्नमेंट बड़ा हेल्थ प्रोग्राम लेके आई, उसको इम्प्लीमेंट करने के लिए एक बड़ा नेटवर्क ऑफ फ्रंटलाइन वर्कर्स को लाया गया. वैक्सीनेशन का जो खासकर काम है वो ANMs ऑक्सिलरी जो नर्स मिडवाइफ है उसका वो एक मेजर रोल इंपॉर्टेंट रोल प्ले करती हैं. लेकिन ग्रास रूट्स पर आशा वर्कर और आंगनवाड़ी वर्कर का जो कन्वर्जेंस है it is critical to the overall impact and the outcome of the vaccination program, one, and the health and nutrition outcomes that we largely see to, you know, reaching out to the sustainable development goals to have zero hunger, malnutrition. So इनका बहुत critical role है. और अगर हम लोग सिर्फ कवरेज की पॉपुलेशन की बात करें तो मोर और लेस आंगनवाड़ी वर्कर और आशा वर्कर सेम पॉपुलेशन पे काम करते हैं. और आपको उदाहरण के तौर में बताता हूँ कि जिस एरिया हम लोग काम करते हैं उसके ऑपोजिट साइड पर एक कम्युनिटी है जिसको हम लोग दे आर चिल्ड्रन ऑन स्ट्रीट. हम लोगों ने 2014 में जब उनके साथ काम करना शुरू किया, वी फाउंड दैट कोई बच्चा टीकाकरण के कवरेज में नहीं था, किसी भी माँ का कभी एंटीनेटल चेकअप नहीं हुआ था, वो कभी भी हेल्थ सेंटर नहीं गए थे. हमने जब हेल्थ सेंटर से बात की, उन्होंने बोला कि ये हमारे कवरेज एरिया में नहीं आता. तो हमने बोला कि आप अगर इसको अपने कवरेज एरिया में ले लेंगे तो शायद हो सकता है कुछ आउटकम्स यहाँ से आने शुरू हो जाएं. तो फर्स्ट थिंग वी अचीव्ड कि हमने उनको उस कवरेज एरिया में लेके आए.
These whole technical aspects where you have like, you know, a very demarked area that you will not go beyond it would lead a lot of people or children especially to be excluded from these benefits of vaccination. So coming to you, vaccination is also given to women who are pregnant and also to adolescent children, and we are seeing a lot of new vaccines which are being introduced. Do you think people are a little more hesitant when they grow older, and if they have to immunize their, say, daughter for HPV, which is, I think, in the teenage years, I believe, do people come to you with?
Yeah, nowadays in the metros, you know, people are getting vaccinated for HPV vaccine, the human papillovirus, you know, that saves females from cervical cancer, vulvar and penile cancer, you know. So I think the conversions are getting higher nowadays. And for the female, we immunize 9 to 14 years, you know, 2 doses are there. And for the older, we have 3 doses of HPV. And we are seeing conversion. Plus that Tdap vaccination has been now growing in the pregnant women, you know. That gives the maternal antibody to the newborns, you know. Because the first vaccination of DPT starts at 6 weeks. So that covers the first 1.5 months of that baby.
Even in adolescents, most of the adolescents don't come to the pediatrician. That is the biggest failure in the program. Age group. Because a lot of people think pediatrician means they are seeing small children. So they don't come for us. One reason. So the vaccination in adolescents is very poor as compared to vaccination below 5 years.
But it's extremely crucial, I believe.
It is extremely crucial because we have the Tdap, HPV vaccine. If they have not received other vaccine, we can catch up vaccination too.
So now what we have started in my clinic, what I do, that I used to counsel all the female child from the childhood only, below 5 only, that you have to get one cervical cancer vaccine. And this word cervical cancer really catches them, you know, that this is a big, and then we educate the mother also that you should also take 3 doses, you know.
We see a lot of new development happening, like we have at least 3 Indian companies working on the dengue vaccine, and we just recently heard that the malaria vaccine trials have shown pretty good results. So how do you think, would India be able to adapt them in the universal immunization program system that we have?
Only the problem, they introduce only 2-3 countries in the world first. Secondly, the vaccine is recommended between 9 years to 45 years, and dengue occur in any age group.
Yes,
so that is the
that's the whole.
And first, we have not having no experience of the vaccines.
Few countries like 11 countries have adopted that dengue vaccine. But the problem is that the manufacturer has told that you can give this vaccine to those people who has already infected with dengue, you know.
So we still, a lot of work needs to be done in this field, I believe.
3 companies are actively working. One is Panacea, biologically, you know, they are working on that. I hope that they will get soon a very good vaccine for dengue.
Malaria vaccine is introduced
just like recently, yes, this week.
Malaria in Africa. So we'll see for the future of these vaccine in India.
Thank you all of you, sir, for being a part of this and sharing your experiences with us. So we have this campaign on Network 18 going on for an entire year. So please stay tuned to have more such healthy discussions, to view and participate and learn from all these on vaccinations. Thank you.